Alright, welcome back. We're going to continue the rest of the beige flowers for lack of interest in the present. But to begin with, I wanted to start with a meditation. So I'd like you to close your eyes. Put your feet on the floor if you can comfortably reach the floor. And I want you to bring your attention to the breath. And what I mean by that is not changing the breath in any way. You're simply going to focus your attention, which may be all over the shop. You may have come from something very hectic. And I just want you to sit just quietly and comfortably, however is most comfortable for you. If you can put your feet on the floor, that's wonderful. If not, don't worry about it. You can sit on the floor or lay on the floor. Just become very comfortable and very settled. And bring your awareness to the breath. Be aware of your inhale and your exhale. And let that awareness just be observing. Try to remove any judgment that may come up, any fear about should I be breathing differently, something going wrong, maybe I should be doing this differently. Try and let all of those ideas go and just watch your breath. Focus all your attention now just on the out-breath. So your breath doesn't change in any way, but your focus moves purely to the out-breath. And just watch the quality of that out-breath. Again, not changing it, not judging it, not wishing it were different. Just observe that out-breath. And now take a moment to shift just your attention to the in-breath. Not worrying about anything else as the mind takes over. Letting those thoughts just float by like they're on a cloud. Knowing that anything that's important will come back to you later. And at this moment you've set aside just purely to watch the breath. No other purpose for you to be doing right now, but just watching the breath. Now if you haven't done so already, and you feel comfortable doing so, close your eyes. Now bring your awareness to your entire breath, and this time we're going to change the length of our breath. So as you inhale through your nose, I want you to move your belly out and push it out a little bit. Let your ribs float out to the side and watch as your chest lifts as you take in a more full, complete and long breath. And then when it's comfortable for you, start to exhale, beginning with the chest, watching the chest lower, watching the ribs come in, and squeeze your belly back, letting that exhale complete through your nose. And when it is comfortable for you, again, take a deep breath in, belly, ribs, chest lifts, and whenever is right for you, chest lowers, ribs come in, squeeze your belly back, and just keep deep breathing, using your abdomen to help deepen your breath. Let your attention keep coming back to the breath. Keep coming back to your focus on the breath. And now, because you have brought your focus and attention here, you can move your attention away and maintain that same long, deep breath. And you can move your attention now to an imagery. I want you to feel as though wherever you have contact with the ground, perhaps it's a chair, I want you to imagine that there are tree roots growing from your feet or your whole body if you're laying on the ground, your sit bones if you're sitting on a chair. I want you to imagine that the tree roots are growing from this place of connection with the earth. And I want you to imagine that they are growing down into the earth. They're breaking through the dirt. And you can sense the coolness of the earth as those tree roots grow from you down deep into the earth's ground. As those tree roots grow further and further down, you feel a sense of heaviness, connectedness, solidness. You feel the coolness of the earth as those tree roots keep going down, right the way down to the center of the earth. And feel that safety, feel that security, feel the solidness of your connection to the earth. And now take a moment to bring your awareness back to your breath. Feeling that inhale and exhale. Notice if the quality of your breath has changed at all. Notice if you feel any different. Just observing what's happening. Not judging it as right or wrong. Just observing. And as you're ready, you can give your fingers a little bit of a shake around, a little bit of a movement. You wiggle through your toes, you wiggle through your fingers. Make some circles through your wrists and ankles, first in one direction and the other. And if it's right for you, you can stretch out through the length of your body. And when you're ready, open your eyes. So that's a really simple meditation in grounding. And that sense of connection, that sense of being supported, is one way to feel groundedness. But there are many other ways. Last section I asked if you yourself do any grounding activities, and it would be great if you felt compelled to maybe go onto the forum, the blog site on the LMS, and just put in some ideas that you have that work for you personally, or that you've read about and like to try, or perhaps how you found that meditation, and have you heard of variations on that meditation? That one's quite a common one. And just kind of chat about your experience with these grounding activities, because if you're wanting to prescribe them to patients, sometimes it's really helpful to have like a wide variety of options so that you can choose one that suits that person in front of you. And sometimes it helps to try some of these meditations and to speak them out loud. If you're wanting to take your patients in clinic through these meditation practices. Alright, so the next flower that we're going to be doing in this subset is olive. And olive is one that can come out towards the end of semester for students because it's the beige flower of exhaustion, overwork, tiredness, when you've been burning the candles at both ends. It can be physical or mental exhaustion, but you are exhausted. Think of adrenal depletion, think of adrenal exhaustion, think of when you're at the end of semester and you've just done a bunch of exams and written a bunch of assignments, that kind of completely numb feeling that you can get with mental exhaustion. And so olive is that state of physical tiredness and lack of energy. And it is the lesson of olive and the wisdom of olive to recognize the need to kind of fill the well back up again, to at all times cultivate practices that enable you to fill back up, that so that you don't end up in that exhausted, depleted state. That's the lesson really of olive. It's also about accepting the times when you need convalescence, when you need to say, no, I need time out, when you need to honor your body and the state that it's in, and be at peace if that means time out, or taking it a little less intensively, or feeding what's necessary to keep you maintaining that same level of discipline, physical or mental discipline, that perhaps is required in the moment. What is it that brings you both peace of mind, and also what is it that can renew your vitality, whether that's physical or mental, emotional or spiritual? So olive is exhaustion. And I'm presuming I don't need to prompt you in what adrenal exhaustion means and the different phases that move toward adrenal exhaustion. And olive can really be at any phase of that. So olive is for convalescence. It's a beautiful essence for respecting the importance of rest as well as sleep. And having those two things is very separate in your mind. The next essence is white chestnut. This is a very popular essence generally with students, and it comes up a lot in clinic. There's a lot of times where I've used white chestnut with patients. There's white chestnut times in life. Well, white chestnut, if you look at it, it's a very busy inflorescence there. You've got loads of little florets, and it's a very busy looking flower, and there's a lot happening in that flower. And white chestnut in the beige remedies is persistent unwanted thoughts. Thoughts that go around and around in your head. They're playing on a record that's just stuck in a groove, just going around and around and around, the same ideas, the same thoughts. And the mind is kind of trapped in that state, unwilling to let go of the thought. And there may be many reasons for that. One is this idea that if I let go of this thought, then I'm essentially saying that I'm okay with it. And it may be that the thought is about an unhappy situation, something not pleasant that happened to that individual, that happened to yourself. And the idea of kind of letting go of the thought is connected in some way with the idea that you're saying it was okay what happened. I give permission for that situation to occur again. It's kind of like the mind is attempting to protect the individual the best that it knows how. And it comes up with this kind of persistent thoughts that can lead to hatred and revenge and thoughts of hurting other people. And, it can lead to dark places. But it is the mind attempting to protect the individual. It's there for a reason. Other white chestnut presentations may be obsessive-compulsive disorders. It may be this continuous striving for perfectionism. It may be trying to control the situation, trying to think of ways that you can make things right again. It may be that there are persistent unhappy thoughts that are going through your mind, so things that keep you up at night, for example, things that keep the patients up at night. So something that happened during the day that didn't play out the way that you'd want, and you just obsess about it to the point where you have insomnia as a result. And so white chestnut is about kind of stilling the mind. And when we think of the colour white, and we think of that spiritual aspect to it, there's often a meditative aspect to it. There's a calming aspect. There's a clarity that is associated with the colour white. And white is also associated in some cultures with peace. That's why it's given at significant times, like wearing white at births, giving white flowers at funerals. There's a peacefulness and a mind clarity that comes with the colour white. And also, white chestnut is about letting go of the illusions of the mind around holding on to a thought so that the other person doesn't get away with it. This is about kind of letting go with grace what can no longer be changed, and recognizing that that pattern of holding is an incredible drain on the individual, not the person that the thoughts are kind of aimed towards. It hurts the individual. And so, in a way, white chestnut can be used as part of a forgiveness process. So, think of persistent unwanted thoughts. Think of, particularly when people try to justify it in clinic, and it also can be useful because it calms the mind. Some people do use it for meditative practices as well. So there's something else to perhaps think about with white chestnut. Mustard. Isn't this a beautiful flower? Again, that brilliant yellow. It's almost like a beacon of hope, like a little flame. Have you ever seen a mustard field and you see these kind of row upon row of these beautiful yellow flowers? They just take over the landscape, and it's such an uplifting thing to see. And that's really what the flower mustard is used for in these remedies. It's used for uplifting in moments of deep gloom and depression from unknown origin. And I remember reading a case study of mustard that described mustard as like a black cloud that kind of comes over the top of someone all of a sudden, kind of rains down upon them and then shifts just as quickly. And that's what mustard can present like. That's what it often presents like. It's kind of sudden black depression which appears out of nowhere, and lifts for no real reason, and it's quite extreme place of gloom, you know, like a lack of hope, so you might want to mix it with something like gauze. And it's the suddenness of mustard that makes it unique. Now, whether the black depression is descending and lifting out of the blue, or whether the individual is kind of a little bit removed from the underlying issues, perhaps they haven't really spent much time delving into what perhaps is causing the depression. So one of the positive outcomes may be that they start to develop a sense of who they are and then recognize the triggers toward depression. There's also an understanding that darkness is temporary. Some people are predisposed to this form of depression, and it's something that they live with on a day-to-day basis. And mustard can bring back the positivity and the ability to return back to joy and serenity and stability after this time has passed. Remember, with depression, I probably shouldn't have to tell you, but it is something that would be a red flag, particularly if those deep gloom do turn into suicidal thoughts, for example. I'm hoping that you're sensible enough to know when to refer. Also think about things like postpartum depression, also menopause and associated depression, seasonal affective disorder. Some people suggest that it may be appropriate for bipolar. Remember that these are all kind of conditions that require medical assistance, or that may require medical assistance. So just keeping in mind that this flower can be used, but the bigger picture needs to be taken into consideration. And chestnut bud. So we've had white chestnut, we've had red chestnut, now we have chestnut bud. Big fan of chestnut. So chestnut bud is the bud just before the flower itself opens. So we don't really have an indication of color here, but we do have a really strong doctrine of signatures. If we think of the flower as like the wisdom, the ultimate expression of wisdom of the plant being perhaps the lesson, you know, the experience of life, and the flower being the crowning glory, the expression of the wisdom that the plant is there to provide. Chestnut bud is just before that expression, just before that awareness, just before that understanding. And so it's used in the H remedies for failure to learn from past experience. So for those individuals who find themselves in the same situation time and time again. An extreme example of this could be kind of domestic violence situations, for example. They find themselves with the same type of partner in the same type of situation again and again and again. And there's almost a compulsive repetition of the mistakes. And it comes down to the inability to learn what that lesson has. And so the positive outcomes of this flower remedy are to keenly observe mistakes, so to really take time to recognize, what am I continuously doing? How am I contributing to this situation? Once that knowledge and wisdom is gained, so remember, flower essences can help to take you above the situation and just simply observe. And in that observation comes spontaneous wisdom, comes knowledge. people are able to observe what they're doing, or perhaps learn from others and move through that life situation. Now, of course, this may require counselling, depending on the severity of the issue and whether those repetitions continue to happen. But this can be a big stumbling block for a lot of people, and it doesn't just have to be that type of example of domestic violence. It can really be anywhere in life where you keep finding yourself in the same situation over and over again. So it could be that you keep finding that your study habits are not helpful. You find that you leave everything to the last minute, and then you get really stressed and really exhausted, and you end up with a cold, and it happens every single semester, for example, despite you wanting to change. So it doesn't have to be an extreme example, is what I'm suggesting. So this is a quote, again, by Edward H. This remedy is to help us to take full advantage of our daily experiences and to see ourselves and our mistakes as others do. So this is really for patterns of behaviour that are generally quite destructive in the lives of the individual. And as much as you may be able to see that as a practitioner, it needs to be the patient who finally observes the mistake that they're making. So it's kind of like they need to recognize that they have a big part to play in this, and they're perpetuating this cycle. And once they can recognize that, the wisdom can finally come. The assistance can be sought, but it's not until that recognition happens that anything can change. So finally, we have a case study. With this one, you're going to go through the same steps as before, and make sure that this process is really clear in your head, because this way of setting things out and this way of looking at fluorescences can take them from being kind of abstract ideas and rote learnt stuff into something very tangible, very practical, very integrated into your practice, so that you can hopefully feel very comfortable moving into clinical practice with this as a very useful modality to use. The last point there is to try and create a meditation or perhaps a visualization that may assist this particular patient. So have a think about what they're presenting with, and have a think about what you may start to think of as a meditation. Of course, you're going to ask your patient if that suits their belief pattern, if that suits them as an individual, if that's respectful of their choices. But to start with, just kind of gather some ideas, and that might help for when you actually move into clinic, that you kind of already have some ideas in place. It's the lifestyle aspect, isn't it, of naturopathy. So thank you very much for listening. I hope you enjoyed this session, and I'll chat to you soon.